Assalamu alaikum. Today we'll be demonstrating a cerebellar examination. We'll start with general YP mnemonics, so I'll wash my hands, but I have already worn my gloves. I'll introduce myself. My name is Momin Halabi. I'm a fourth year student. I was asked to do a cerebellar examination on you. Would that be okay?
Yes, that's okay.
Okay, I'll assure the privacy and also confirm the patient's demographic. Also, I will make sure that certain areas that I'll examine will be exposed, so his legs in this example. Are you in any pain right now?
No.
Okay, thank you. Okay, first we'll assess the speech. And by speech, we don't mean the language, so no repetition, comprehension, and fluency like we did in the mental status examination. We'll just assess the articulation of words. So I'll ask the patient, can you tell me your full name, please?
Ibrahim Bishawri.
Okay. So from the way he spoke, I can see that his articulation is fine. There's no dysarthria. And also from the YP, when he told me his name or gave me consent, I can also see the articulation of words. So in this patient, there is no dysarthria. Okay. After speech, we will assess the mental status examination. We can have a separate examination just on mental status, but it's not really indicated in cerebellar examination. And it's really a cause-dependent examination. So if I suspected something, I will do mental status examination, but it's not really indicated in cerebellar examination. But if it was, I will do it by answering the questionnaire of MUMSI or MOCA. After mental status examination, we'll be examining the cranial nerves. Of course, we have 12 pair of them, but what we're interested in cerebellar examination are oculomotor, trochlear, and abducens, which are 3, 4, and 6, because they control the extraocular movements of the eye. How can I test it? By facing the patient and ask him, can you please stand up? I will do an H-like movements because it will allow me to test the functionality of 4 recti muscles and 2 obliques, superior and inferior. I will ask the patient, first of all, to focus on my nose and follow my finger only with your eyes, okay? في حاجة مهمة هنا. Okay, I want you to follow it, okay? I will extend until I don't see the sclera part of his eyes. Elevate, depression. بعدين الجهة الثانية. I don't see the sclera part. And if I want to be sure, isolate the elevation and depression of the eye muscles. That will be it for the H movement. It's really important and crucial to comment on nystagmus and also diplopia. So I'll ask the patient, did you notice any double vision or diplopia?
No.
Okay, after cranial nerves, we'll be examining the motor system, and we'll start with the tone. It's important to notice that patients with cerebellar disease can be hypotonic or normal. And how do we assess the tone? First of all, I'll come to the patient. I need you to relax. Can you shake my hand, please? Okay. Relax. So it's passive movements. What do we mean by tone? It's passive movements. So I'll do all the possible movements of the muscles of the upper limb. So shaking, pronation, supination, flexion, extension. I'll also tell him to relax. كيف الاختبار معك كان؟
والله ماشي الحمد لله.
Okay. Flexion of the elbow, circumduction of the shoulder. As you can see, I started distally and then went proximal. It's good إن أنت تختار واحد منهم and تستمر عليه. Can you please remove your watch?
Okay.
إذا أنا سويتها في اليمين فلازم أسويها في اليسار. Same thing. Relax, passive movements, pronation, supination, flexion, extension, flexion of the elbow, circumduction of the shoulder. That's it. I did not notice any hypotonia. Tone seems normal. Ideally, I would also do it to the lower limbs as well. Okay, we're still in the motor examination. Now we'll assess the power. Of course, I can do it like we did in the general neurological examination. So I will apply resistance to each muscle, whether elbow extension, elbow flexion, finger abduction, finger extension. But what we're interested here in cerebellar examination is the rebound phenomenon. So I'll ask the patient, can you please extend your hands? I need you to close your eyes, okay? And I'll press gently on your hands, okay? Okay, خلاص, you can relax. As you can see, the rebound phenomenon here is normal. In patients with cerebellar disease, we can see that he will overshoot or try to take a long time until he returns to his normal posture. Okay, so we will continue with the motor examination now with the reflexes part. There is 2 specific reflexes that I want to see, I want to assess, which are the triceps reflex and also the knee jerk. Why? Because I can see the pendular effect on them clearly. So pendular effect is a manifestation that you can see in people with cerebellar disease. So we start with the knee jerk. Okay. Ideally, you have to expose that area, but if I can sense and if I know my anatomy, inshallah, I will make sure that he's not putting his weight on something, so it's his leg is flying off, yani. Okay. Okay. Also the second leg. Okay. Someone might see that this reflex and say it's hyperreflexia or something, but in young adults it can be normal, like especially in knee jerk, because it's really obvious to see. And then I'll do with the triceps, and I'll do this movement. Ask him to relax, please. Okay. I can see the olecranon process. Here will be the tendon of the triceps. Okay, do it to the left. Relax. That's it. I've also have to comment. So the reflexes were normal. They were not hyperreflexia, and also didn't notice any pendular effect. We're still in the reflexes aspect of the motor examination. We've done the triceps and also the knee jerk. Now we'll do the Babinski, or the plantar response. I'll ask the patient to lie down. Can you please lie down? Okay. I'll make sure that his sole of feet is exposed, because I will scratch him with this object. It's kind of sharp object. Okay. I'll start from here, go laterally, and then medially, and end on the big toe. Okay. I'll do it again. As you can see, I saw no movement or slight flexion, which is normal in Babinski. If I want to be sure, I can do it on the left leg. Same thing. Laterally, and then end on the big toe. Medial, lateral, and then medial, end on the big toe. I saw flexion of the fingers, which is Babinski negative. Of course, Babinski is not that important in cerebellar examination, but we have to do it. Why? It's usually negative, which is downgoing movements of the fingers, but it can be positive sometimes in spinocerebellar disease because of the involvement of the spine. After we have done the motor examination, now we'll move to the sensory aspect or sensory system. It's important to note that we have 5 main sensations, which are from the dorsal column and spinothalamic. Spinothalamic gives us or transmits the pain and temperature feelings. And regarding the dorsal column, vibration, proprioception, and also crude touch. It's important to test all of these sensations on a dermatomal pattern or distribution, but it's not that indicated in the cerebellar examination, so we will skip it, but ideally we have to do it. And if you want to master it, inshallah, you can refer back to the general neurological examination that we will do. After we finish the sensory aspect of the cerebellar examination, now we'll move to the coordination, which is a really crucial step because we're examining the cerebellum, which one of its functions is coordination. So we'll do more than one test. It's important to note the results of each one of them. First, we'll start with dysdiadochokinesia. سامحونا الكلمة شوية صعبة, بس we can say it's rapid alternating movement. Okay. I'll ask the patient. I need you to do this in one of your hands. Either one, it's okay. Okay, yeah, like this. Quickly. Yes, try to lift it up. Okay, on the other hand. Quickly. Okay, it's okay. Okay, it's okay, خلاص. You can relax. Because he did it on the second try with his left hand, which is not the dominant hand, so there was some slight error, but it's okay. It's important to notice that or to comment on the rapid alternating movement was fine. There was no like miscoordination or anything. And that's it for dysdiadochokinesia. So now we'll do the second test in the coordination, which is finger to nose. There are 3 main results or findings that I have to comment on, which are dysmetria, intentional tremors, and coordination. I'll demonstrate now how we'll do the test. Okay. I'll face the patient as always. I'll try to extend, please. Okay, so نحاول نكون المسافة كذا الاكستنشن حقي وحقه. It's good. Okay, relax. I need you to touch your finger, touch your nose with your finger, and then touch my finger. Okay, so like this. تمام? Okay. Okay, stop. If I want to assess the dysmetria, I can change the place of my finger. So I can make it closer or further away to see his sense of spaces or destination. Okay. As you can see, it's not dysmetric at any way. I did not notice any intentional tremors. Intentional tremors and his coordination when reaching my finger is good. Intentional tremors because هو بيحاول يوصل للديستنيشن حقتي فيبالها في النهاية تركيز وسكيل فهناك يبدأ السيربيلم يشتغل. if he has cerebellar disease هنلاحظ intentional tremor span upon reaching my target. It's important to comment on those three findings. After we've done the finger to nose ومنها مرة واحدة I examined the tremors, especially intentional tremors. Also, I did the dysdiadochokinesia. Now we'll move to the foot tapping. Okay, it's the same concept of dysdiadochokinesia. It's a rapid alternating movement, but we can see it in the lower limbs. Okay. لما كنا بنقيس البندولار افكت كانت رجله معلقة. دحين it's important أقول له أنزل شوية. Can you please? Okay. عشان رجله تتكي على الأرض. And I need you to do this. Try to make this on the ground. Your heel. Okay. Do this quickly, please. Quickly. Okay. Looks normal. Can you do it on the other leg? Same thing. Okay. Same thing that we've done in the dysdiadochokinesia because he uses his right most of the time, so his left is kind of slow, but it's okay. People with cerebellar disease, they'll find difficulties doing this movement because it's rapid and it needs skills and coordination. After we've done the fourth test of the coordination, now we'll finish it off with heel to shin. It's similar kind of to the finger to nose, but it's in the lower limb. I will assess the dysmetria and also the coordination. I'll ask the patient, can you please lay down? Okay. I need you, I'm sorry, I'm going to move your leg to demonstrate how you can do it. I need you to lift your leg and slide down your shin from the kneecap until, like this. Okay. And do it again. Okay? I need you to do it here exactly. Okay. Again. Okay, خلاص, you can relax. Do it on the other leg. Again. Yeah, looks fine. خلاص, okay, you can relax. Things that we can see here in this test is dysmetria as well, same as finger to nose, and also the coordination. So he was able to maintain his shin on his heel on the shin along his leg multiple times, so in both legs. After we finish the coordination test, now we will move to the gait assessment. So I'll ask the patient, can you please stand up? Okay. Come here, please.
Okay.
أبغاك تمشي من هنا إلين هناك وترجع لي. Slowly, please.
Okay.
تمام. As he's walking, I will comment on the coordination. His turning seems normal. It's really important to talk about his turning. His base seems normal, is not broad-based or anything. Now, I need you to walk on a straight line, okay? Yes, exactly. So I can also assess the coordination. Okay, come back, again, straight line. Okay. So people with cerebellar disease will have positive findings. So his coordination will be wrong. He'll have difficulty in turning. His base will be broad. So we have to comment on all of those findings. After we finish the coordination, there is one last thing test that we will do, which is the Romberg test. We're mainly focusing on the proprioception aspect of the cerebellum. Okay. So can you please stand up? I'll ask you extend your hands like this, and I need you to close your eyes. It's important to tell the patient that you will be around him. If he loses his balance, you will be there to catch him, inshallah. It's important to notice that the ability of the patient to stay balanced depends on his eyes, vestibular system, and also the proprioception. If I eliminate his eyes and ask him, can you please close your eyes? I'll just watch him. The balance seems normal. He's not losing his balance or falling. Okay, you can relax. Thank you. فأنا كده عارف إن هو is not having any problems in terms of proprioception. If it was positive, it doesn't mean he has cerebellar disease. It just means that he has problem in his proprioception. It's really important to note that. Okay. After we finished the Romberg test, it was the last test of the cerebellar examination. It's important to summarize the result. Thank the patient. Thank you, Sheikh Ibrahim. Wash your hands. And that will be it. Thank you, guys.